The Ghana Medical Association has issued a statement signed by the President and Acting General Secretary, who is actually joining us on the line now. That's Dr. Richard Selormey. Doc, you're welcome to Eyewitness News.
Yeah, thank you very much, Umaru.
As a body of doctors, having seen this news, some 14 persons affected, one of them died. It's eyebrow raising for the ordinary person, but for you, the professionals, is this a normal thing? What is your reading of the grounds, and what should we do?
Good evening to your listeners. I can understand from the normal person's perspective that sometimes when outbreaks like this happen, people will get scared and people will be set into the panic mode. But we would want to caution and encourage people not to panic. The important thing is to take the measures that the Ghana Health Service has advised for people to take precautions to prevent the spread of the disease rather than panic. And that may actually lead to the spread of the disease. When outbreaks like this happen, because some of these conditions are rare, typically the first people might not present early, and you might see situations where they might present late and you might have such fatalities. However, that is not what we wish. And typically once it's picked up, you realize that measures have been put in place to quickly control the spread and also identify cases much earlier and manage them better.
I see. We are told that usually the first responders or the medical officers who attend to such persons who may have carried the virus unknowingly into the wards and other places are the ones who get affected. As professionals, health professionals, are you getting the adequate protection that you need so that you do not become conveyor belts onto other patients in the hospital if you receive this virus from a patient who brings it unknowingly?
Yeah, indeed, among the 14 persons, we are aware that some health professionals have been infected, including doctors, some nurses, and some close contacts of these people. Yes, it's true that these people have been infected, but as we know, PPEs and protections are both the PPE dependent and then also people dependent. So we are encouraging, that's why in our message to our members, we encourage them to adhere strictly to the IPC, infection prevention and control protocols, so that they can minimize the spread of infection spread among professionals and then from professionals to other patients or community. Yeah.
Are you getting the adequate PPEs though? Do you have enough? What I mean is that is our health system ready and prepared to deal with an issue like Lassa Fever outbreak?
Well, PPEs can never be enough because they are not items that you use and reuse. So we would also call for more PPEs to be used. Generally speaking, it is direct contact with bodily fluids, unlike in the situation of COVID and other respiratory viruses that is spread through droplets or through the air. So in this case, as much as possible, we think there are generally adequate amounts of PPE in most facilities. However, with the increase in numbers, that will require more and more PPEs, and we'll call on government to ensure that adequate numbers of PPEs are procured for all facilities, and then the infectious disease centers that are handling the cases be stepped up in terms of PPEs and other supportive treatments that are required for care of patients.
Now, I do know that this should be something that we should not equate to the outbreak of COVID-19, which is a pandemic. We've been able to generally deal with the issue of COVID-19. That would then mean that our system has enough shock absorbers to deal with Lassa fever. There should be no need to be worried, should there?
Well, as I mentioned, the good thing is that when you go through a pandemic, you build in some experience, both human as well as some resilience in the system. And that is why you realize that this has been picked up quite early and contacts are quickly being traced. The other bit is also that while that is good, the virus is different from COVID-19. And therefore, for example, what is required to manage COVID-19 is a bit different from what is required to manage Lassa fever, which is a hemorrhagic type of fever. People might, in the severe form, need and even need blood and other things which may not necessarily be required in COVID-19. The medication that is found to be yielding good results in this one is ribavirin, which is also not so common, but then we know of efforts government is making to try to procure some to be available in the system. And we have called on government and are working closely to push government to ensure that this is available in adequate numbers to manage cases in case there's a blow up of cases. So I think the system in general is better prepared than where we were when Ebola and COVID came, but we still need some additional things to make sure that we are fully prepared to handle the numbers in case numbers go up. But we are hoping rather that we prevent the spread than have to deal with cases.
The next question I'm going to ask you is not related to Lassa fever, but it's also bothering on the health sector. The issue of the vaccine shortage. Do you have any comments to make on it so far since the announcement came? Has there been any resolution to the matter?
Well, we are informed. We have made some informal calls to government to ensure that the vaccine issue is addressed, since it's quite a serious matter. And one of our subgroups, the Pediatric Society, actually issued a statement to the matter, and we have done direct follow-ups. We are not certain at this point. I don't have information that the vaccines have been procured, but we have been told of efforts to ensure that it comes in within the next 2 weeks or so. But I would have to get better informed on that matter to speak to it. But we are encouraging government to ensure that the vaccines are available as soon as possible to prevent the re-emergence of vaccine-preventable diseases.
Thank you so much for your time, Doc.
Thank you so much, Umaru.